Good morning. Welcome to the TNT Open Mind series. Angelina, my name is Sarah, and I'm just so excited to be talking to you today.
Hi Sarah, so nice to meet you. I'm really excited to be here today. This is a wonderful opportunity.
Awesome. Um, I always like to get to know you a little bit, and so are you able to tell us a little bit about kind of your background and kind of what's even bringing you to coming here and talking to us today?
Yeah, I would love to. So my name's Angelina. I'm a former foster youth, so I did grow up in the foster care system. I entered at the age of 6, so I pretty much spent my whole childhood up until adulthood in the foster care system. Um, I ended up getting employed with iFoster when I was 21, so that's when I ended up developing my passion to supporting former foster youth. I've been with them since I was 21. I'm 28 now, so it's been about it's gonna be about 7 years.
Oh,
So
wow.
it's been a journey, and in this field of work, it just made me realize how important it is to be there for people and all of the unseen all of the unseen things going on in the background with the system. That it's important to bring that to light, and that we need people in these spaces. So I love being in this field of work and working with this population. So I'm really passionate about this, and that's why I'm here today to talk about it.
No, thank you so much. And I actually don't know much about iFoster, and I would love to hear kind of from your lens some of the different things. Can you talk a little bit about kind of what that was like for you being in the foster care system?
Yeah, I could definitely talk about that. I would say it definitely didn't feel very supportive being in the system. I realized a lot of the resources and programs after I was eligible for
Mhm.
them. So there was a really big gap in connecting members to resources.
Okay.
Um, iFoster, they employ former foster youth, so they know it's important for people with lived experience to help others who also have lived experience.
Yeah.
So I feel like that has really made a big change in how we connect with individuals because we connect on the personal level and from
Yeah.
lived experience. And iFoster, we help bridge that gap by connecting them to those resources like basic needs,
Yeah.
mental health support. We have a website, so that's where all of our resources are. Caregivers, former foster youth, and anyone who supports them,
Okay.
they're able to have access to those.
That's
So,
incredible. So again, I'm a pediatrician, I'm a child psychiatrist, and now I feel terrible. I have not heard of iFoster. Are you able just to kind of give us an introduction to what it is, how long it's been around, or kind of,
yeah.
and then go into the work that you do with them?
Yeah, so iFoster is a nonprofit organization. They support local and nationally. So we do have programs running in Kentucky, Ohio, California, and so forth. So we are a growing national
Yeah.
nonprofit, but our goal is to help bridge the gap to resources for those who grew up outside of their biological home. So even if you didn't grow up in like a traditional foster care
Hmm.
family, maybe like it was kinship care
Yeah.
or even just probation youth. We want to support anyone who feels like they
Okay.
had a lack of support growing up.
That's incredible. And what are some of the different services that people can either learn about or access through iFoster?
Yeah, so we have a support team, our
Okay.
iFoster support team. They're there hitting the ground one on one. So we do have a live line that you could call into iFoster,
Oh,
and somebody will answer on the other end, and they'll answer any questions that you have about resources or programs. And even if there's a particular resource that you're looking for that isn't on the portal, they'll be there to walk you through every step of the way, help do research to see what resources they can
yeah.
obtain, and then also like look to our partners to see if they would be able to help as well.
That's incredible. And just so I know, again, I do a lot of teaching of, child psychiatrists or pediatricians. Is this something, medical professionals can call and ask more? And is it also for kind of patients and families?
Yeah, the medical professionals can definitely call and ask. How our iFoster Hub works is we separate the resources into different categories.
Okay.
So we do have a category that is just pertaining to health and wellness.
Oh, great.
So if you do have questions about like what kind of benefits would foster youth be eligible
Yeah.
for, we can help direct you to that category and help walk you through what resources and programs they would be eligible for.
That's incredible. Again, I'm so glad that this exists and it sounds like it's growing. And so
Yes.
that sounds amazing. I think you had mentioned when you were, telling us about some of the work that you do that there were just some negative experiences that you had. Are you able to share any of those experiences for people who are just interested in learning more about kind of what, kids might be going through?
Yeah, I did go through a few negative experiences in the foster care system. I would say the main thing is feeling like I wasn't listened to.
Mm,
Um, Growing up, a lot of choices are being made for you that you don't have any part in the decision making process of it. So the lack of control and what's going on, and the lack of not being heard and not
mhm,
being seen. Because I did have a lot of instances where I would talk to my caseworkers and let them know how I was feeling on an emotional level, but that wasn't really highlighted because they were like,
mm,
as long as your basic needs are met, so you have a house and you have food, but there's just a lot of personal struggles that I was going with like suicidal ideation, and
okay.
it was just really hard because I didn't get any support with any of that. It was mainly just, well, your basic needs are met, so you're good. So
You
I
should
felt like
you
it was
should be
being passed
grateful, you should
along.
move on, you have a house, you have food. That's
Right.
better than a lot of
Yes,
other
and
things.
then it's just so frustrating too because they did have the resources that they could have connected me to, but I didn't find out about them until I was in my adulthood. So
Okay.
it could have been it's I would like to have the connection to those resources for young adults, teens who are going through it, who are in the process of it, because it's so unfortunate that they don't learn about having that connection until after they're already in adulthood, already like trying to
Yeah.
figure out like how they're going to pay their rent and do their bills. Like your mental health ends up getting pushed like way to the side.
Yeah, and I know there's a big proponent that mental health is health, and I do
Hmm.
think your mood, and especially if you're having suicidal thoughts, right? That's an emergency. That's a medical emergency, and we need to think about that in the same way as you having food and you having shelter and you feeling safe.
Hmm.
There's room for the society to grow in that end. Um, Now that you're working with iFoster, what are some of the changes you would like to see, either in policies or in systems?
Yeah, I would definitely like to see more access to mental health care in policies and systems. I do know that in California, we do have coverage till 26,
Okay.
and it does have access to mental health resources there.
Wow.
I think that that just doesn't get highlighted a lot. I
Sure.
think when we think about Medi-Cal, we think about like basic doctor's
Mhm.
appointments, like getting your basic needs met, but they don't really think about therapy when it
Mhm.
comes to Medi-Cal. So I think that would highlighting that would be definitely beneficial,
Yeah.
or having a separate program that focuses on that.
Mhm.
That would be super great.
Yeah. No, and it sounds like maybe there were resources that existed for mental health in your youth, but no one took you seriously, or no one even thought to kind of refer you to resources that existed or even let you know about them.
Right, yeah, that's exactly what happened. The resources were out there, it's just that the lack of connection, because um, social workers, they already have a very high caseload, so a lot of times they do the best they can, but there's a lot that goes unnoticed, and that gets brushed to the side. So having more people become certified as peer mentors and being able to be in these scenes more,
Yeah.
I feel like that would definitely be beneficial. And creating jobs where people are able to use their lived experience and not just use a degree, but to get into more fields with lived experience and how that could support social workers and healthcare professionals. And
Yeah.
because they already have a heavy load, so I know it's like it's hard for them to also like take into consideration when they already have a lot of check boxes that they need to check off. But maybe just having someone that could help support them.
Yeah, no, and I think it makes so much sense based on kind of maybe what you went through, why something like being, a peer mentor could be so impactful in someone's life. Are you able to share a little bit more about, what does being a peer mentor look like?
Yeah, I could definitely share that. So being a peer mentor, that looks like meeting people where they are. So it's not about pressuring people to get certain things done. It's about what goals do you want to meet and how can we meet those goals. It's about creating easy step-by-step plans so that members could follow and not just throwing resources at them and hoping that they'll follow through with them. It's about walking your peer through those resources and helping them understand the program. And if it's something that they don't want to do, don't push it on them. It's peer led. So whatever their focus is, you support them in that.
No, that sounds incredible. And again, it's kind of that mix of, you're not their doctor, you're not just being like,
Mhm.
this is what you're supposed to do. It's more
Right.
like, when I was in the situation, here's some resources that could have been helpful. Is this something that is helpful for you? if you're interested, I can walk you through it.
Exactly.
Awesome. How do you think it's received by the kids you're kind of working with?
I feel like it's received very well. I was on the other side of it of the first year. Well, I was like kind of the guinea pig because we started in
Okay.
2019. So I got experience learning from my coworkers who have done it, who are case managers who've done it previously, and just learning how they navigated like talking with people. It's just it's about meeting human to human. So just being able to be patient and consistent and just meet someone on a human level.
Yeah.
Yeah.
It's really funny. I think sometimes the I have a lot of professional degrees, but I think sometimes the more and more degrees you get, it takes you a little bit away from just the human elements of what we're trying to do, the connection we're
Right.
trying to have in the everyday. And for all of my degrees and certifications, right, I don't have the lived experience that you do. And so I have much less knowledge of what, might be going on with, a kid in that situation. And so being able to partner with you or, have you as a resource to some of these kids and even families. Just that sounds incredible.
Thank you.
Awesome. I know you were passionate about other systems level changes. If you had a magic wand, it could
Mhm.
change all sorts of things. Or again, if you have like concrete goals, what are some of the things you think would be really helpful moving forward?
I think something that would be really helpful moving forward is N supporting outside of transition
Mhm.
age youth, a lot of the resources, they're for 18 to 21-year-olds,
Mhm.
uh, but realistically, we don't really have things figured out by 21, so, foster youth who are 22, they have the lack of support, they don't have any resources, so being able to extend, those resources, I feel like I would change that policy. It was changed, to 21, so there is a
Okay.
possibility that we could get it like pushed a little bit further back. I feel like 25 feels a little bit more realistic
Yeah.
because even covered till 26, we get medical coverage till we're 26 years
Okay.
old, but all the other resources stop at 21.
Interesting.
So it's like,
Yeah, it's
why
almost
can't those match?
random.
Yeah. So if I had a magic wand, I would definitely extend both ages to 26 because I definitely had nothing figured out at 21.
Yeah, and I don't think former foster youth are alone in that. I
Oh
think
yeah.
a lot of transitional age youth, in that time span are still figuring things out.
Yeah.
And so yeah, you're right. It makes sense if your medical insurance gets covered until you're 26, what about everything else?
Yeah.
What are some when you say resources, can you give me some concrete like what are some of the either things you're connecting, other people to?
Yeah, so we have resources like housing resources. There's THP, that's Transitional Housing Program.
Okay.
That program it helps house current former foster youth ages 18 to 21.
Yeah.
Pretty much, they would just have to be have a job or need to be in school to be eligible for that
Mm.
program, and they would supply them with housing, and then they would be able to they supply them with housing.
Yeah. No, that's incredible.
Thank you.
Awesome. Are there other resources that you think there's that really benefit some of these youth?
Yeah, I know technology resource is super beneficial with supporting youth. Having access to technology is super important when it comes to applying for jobs,
Mhm.
when it comes to being in school. So there's a lot of requests for having access to being connected. Because
Sure.
even being separated, even being in the system, you're separated from a lot of your friends and family. So having a connection, having some type of phone connection is
Okay.
super important because you're able to connect with family members, friends, so forth. So I would say tech is a really big one because it helps support
Interesting.
them
Okay.
in their goal setting and helps them get a step further. And another program that I would like to talk about is the iFoster Jobs program.
Yeah.
So we do employ current former foster youth, and we hire them in our jobs program to help
Okay.
work with other current former foster youth.
Yeah.
This program, I love it a lot because they're able to we were able to train them with the peer support specialist certification, and then they use that certification. They apply that certification in the real experience, so they get placed at nonprofit centers that we're
Okay.
partnered with. So they're able to actually like be on the ground and like use their experience to support people and help connect them to resources. And if they do have any trouble with any of that connection, we have a support team there to help back them up.
That's amazing. No, it sounds like this. I'm in love with iFoster. I feel like it's an organization that is just doing just so much good. And again, for kids that maybe when the foster system was created, I'm sure there were great intentions, and I think that's just not always true for all kids who are in the system.
Mhm.
And so I think thinking of ways to make that experience more supportive, more helpful, and again, really kind of get them through that transitional age and elongating what that transitional age is.
Yeah, so right now, iFoster is training their staff in enhanced care management, ECM.
Okay.
So right now, we're working on training our staff on how we could build Medi-Cal, because we understand that physical health, mental health, they coincide with each other. So that health plan needs to be coordinated instead of treating them as if they're in separate silos. So being able to meet someone's basic needs, like getting them a roof over their
Hmm.
head or um, some type of transportation, just being able to meet basic needs is a form of healthcare. So we're getting trained right now to see how we could build Medi-Cal for supporting our
Yeah.
members and help get them to meet their basic needs.
I think that's incredible. Like a recent fact I learned is, I am a doctor. And, someone's health, like 80% of that is based on, a lot of social determinants of health and things like, are they living in a safe place? Do they have access to food and shelter and safety?
Mhm,
All sorts of things that I really don't have a way of impacting. What I
mhm,
could do maybe helps them with the 20% of what's left. And so really thinking it sounds like ways where you can, leverage insurance companies to help with that 80% of really helping someone live a physically, mental healthy, good life. Just sounds so incredible.
Yeah, I'm really excited about it because it's important and like you mentioned, it's you can't you can't work on your physical health if your basic needs aren't met. So if you're feeling sick and you're living outside, your main focus is how can I get a roof over your head? You're not focused on how to treat your sickness. So the but if your basic needs aren't met, you can't focus on the health part of it. So exactly, they coincide with each other. So we have to find a way so that we could coordinate and not treat health or mental health and physical health as if they're separate silos.
Yeah. I think it's so abundantly clear how, your own lived experiences have impacted the work you're so passionate on doing. What is your hope for, um, kids currently in the foster care system?
My hope for kids currently in the foster care system is that they just continue to push forward. I know that there's going to be a lot of times where it's going to be easy to feel like giving up and to feel like the world is against you, but know that it isn't. There's so many people out there that want to support you. They're rooting for you. It might not seem like it right now, but just keep going and you'll find out that the grass is greener on the other side. But I would just like to highlight that because I know going through the system myself, even my sibling, I didn't have a great relationship with my siblings either because it was like we were all in survival mode and it'll get better. But I just want to talk about that and that if you do feel like you are lacking resources and you do want connection to programs, there are resources out there that will support you. Look for them, get connected with them, and they will help you every step of the way. I just want to highlight that advocacy is important, and especially advocating for yourself is going to be super beneficial. So remember that you're important, and remember to advocate for yourself.
No, that's beautiful. And again, I think it's so tough because I tell kids that, I wish I had someone else to advocate for you. I can do what I can to advocate for you. And some of this may be, how can I help find, within you ways to advocate for yourself? And again, I can't imagine, but I'm sure there are times that just feel so hard. And it feels like there's no one who's supporting me and kind of what's going on. And so, what it might mean for a kid who's experiencing that to be able to reach out to, say, iFoster, get someone who's a peer mentor who has, again, a very similar lived experience, if not the same, to at least know, hey, this is someone that I can turn to. They can help connect me to resources. There are people who care. You may need to advocate for yourself and reach out and understand and talk to people and kind of move that forward.
Right.
Yeah, I think sometimes in those times it may feel like there's no hope. And I think what I'm hearing from you is you're really passionate about changing that and making sure that there is absolutely hope and
Yes.
there are people to reach out to, there's resources, and that that's going to continue to grow.
Yes. So don't wait for the resource to come to you. Like you gotta advocate for yourself, and sometimes you gotta do a little footwork to get that done. But in the long run, it's gonna be beneficial because you're benefiting yourself, and not only yourself, you're also showing others that it could be done and that it's important.
Yeah. How do some of these youth even hear about iFoster to know then to advocate or to, try to find a peer mentor?
Yeah, so a lot of the times they hear about us through our resources. So one of our big resources is we were giving out laptops last year.
Oh, wow.
So there was a lot of college students who found out about that and were trying to access that resource. And then that's when we got to share about the other resources that we had in our programs. So that's how a lot of people get to know us. We do also have a lot of great partners, and we get a lot of referrals from those partners. So we partner with a lot of local nonprofits as well as child welfare
Mhm.
agencies. So they send us a lot of referrals because we've been working with them since I believe iFoster started in 2010, but the
Okay.
jobs program started in 2019.
Okay.
So we've been working with them for a while now. But those partners have definitely been super. They've been very important in helping us grow and reach the people that we're trying to reach. Yeah.
No, that's incredible. And I think if there are people listening to this who either want to get involved or, want to help out or want to partner, how would they do that?
Yeah, so you could just go to ifoster.org. We have all of our contact information on there. We have the support line number that you could reach. You could also create an account there. It only takes a few days to get approval. Once your account is created, that's when you get access to all of the resources. So that would be a great place to start. Is you could just start on our website, ifoster.org.
Do you have any other words of advice to, kids who are currently in the system?
Yeah, I would say for words of advice for kids who are currently in the system is to know that it's okay to ask questions about what's going on in your care and in your life. Sometimes it feels like you don't have the space to ask questions, but no, that's okay. It's definitely okay too. And you're there's a lot of decisions that are made without your control, but being able to have some type of understanding about why these decisions are
Mhm.
made could be important. So I would like to add that.
I'm working on kind of helping primary care docs and other, child psychiatrists learn more. So when we are seeing, current former foster care youth, what should we be doing? What advice do you have for us?
Yeah, that's a great question. So I would say it's never about intention. It's usually about the speed of things.
Mm.
A lot of times appointments could go really fast, and there's a lot of questions that are asked that could be really, really deeply personal. And I understand that those questions are important to ask, but maybe approaching it in a different way, like is it okay if I ask these questions, or would you want to talk about this now or later? Or possibly, would you prefer writing this down instead of saying it out
Mhm.
loud? Those could be like different, like better ways to approach it. And also explaining why you're asking certain questions could be super helpful. Like I mentioned previously, there's so many decisions in this foster care system where things are just being decided for you. So, from the medical professional, being able to say, "This is why I'm asking these questions," it'll help build that trust and help build a better understanding from both sides.
Wow, those are like very good concrete, pieces of advice. I love it. I think we can all work on going slower. And I think my personal gripe with the medical system is I feel like they're always telling me to work faster. And I just want to
Mm,
go slower because it takes away my ability to kind of be present with someone. And again, a lot of that asking permission.
mhm,
And again, you're a kid and you might have had to take charge or advocate for yourself, and so kind of owning that that is true and giving you some ability to have some power in the care, whether it's what we're talking about today
mm,
or whether it's kind of in the decisions that we're going to make going forward.
right. Yeah, and another thing I would add is that um, it'd be helpful for people to not assume resiliency. So even if you do see someone and you know that they've gone through a difficult situation, don't assume that they're strong and that they got it. Maybe help support with some resources. I don't think that they should be aware of all of the resources, but have some type of way so that they can help connect them. maybe like in the lobby have some posters up of like some local resources or something that'd be beneficial for them that they could just look at.
Yeah, I think, so many people walk through, medical doors, and we have to make all these assumptions. And I think, you know, even if you are strong and resilient, doesn't mean you don't also need help.
Right.
And so just making sure that those are public, visible. Even if I don't know the resources, I at least know that iFoster maybe has some more resources that I don't know about, and making sure that I can kind of advertise that in some way.
Definitely.
Any other tips for doctors, medical professionals, nurses?
Yeah, I would say that being consistent is super important. Um, Having a consistent doctor, someone
Mhm.
you're meeting consistently, is super beneficial. So it already helps build that trust because you're seeing the same person occasionally. So not having like an exchange of doctors
Mm,
or caregivers, that'd be super helpful, and just being able to be there every step of the way, and even if it's not every step of the way, but just being consistent is just super helpful because former foster youth, they don't deal with a lot of consistency, so a lot of times when things are getting changed out very often, they don't really feel free to open up. So sometimes when you do see someone more often, they'll feel more comfortable to tell you a little bit more. So if you do have a former foster youth that you've been seeing for a while, they'd probably be more likely to open up rather than one that you haven't really seen.
no, I mean that makes a lot of sense, and it's funny because I think sometimes as doctors, we feel like our job is to kind of fix whatever it is that brought you in with us.
Mhm.
And maybe actually our job is just kind of sit and be consistent and build that relationship with you as we kind of even get to know who you are or what's going on, um, and what you want to work on kind of going forward.
Y you said it definitely better. Yeah, that's perfect, well said.
Awesome. Anything else that I kind of didn't ask you about that you're really excited about sharing with our audience today?
Mental health is a policy issue, so we can't work on our mental health without our basic needs, so policy affects how those basic needs are met, who's eligible for resources, and what those resources are. So being able to better our policy so that it helps support mental health is definitely important
Yeah.
and needs to be addressed.
What you shared is just really incredible to hear. Thank you again so much for coming on here. I mean, sharing such a big part of your story. I think it's so clear why, your own lived experience is such an important part of the work that you're doing now. And it sounds like you're doing very well. Thank you for the difference you're making in other people's lives. And we hope that really more people learn about iFoster and can use it and also kind of help it expand and grow. So thank you so much for your time today.
Thank you so much for this opportunity. It was such a pleasure speaking with you.
Yeah.